Dear friends, constipation. Everybody must have heard of this, and usually will be making fun of these things. And almost everybody would have experienced constipation at least once or twice in their life, and they know the problem of that. But in general, when people tell that I am constipated, there are a lot of different meanings for that. Not that all the constipation is same. So because I find people say that I had constipation, I called my friend who is a doctor in US. Then he suggested some syrup, and then I took that. Actually my constipation worsened. Then I searched on Google, and I took some Kayam Churna, that sort of things, and then my loose motion increased. All that they will be telling. So constipation, when we have to ask individually what exactly they mean by constipation. Because everybody tells if there is any upset in the stomach, they feel it is constipation. If somebody says constipation, it may be that they don't pass motion every day. They may pass once in alternate day or once in 2 days or 3 days, and they feel that is constipation. That is one type of description. Some people will feel that they don't have complete evacuation, feeling of completely evacuated the bowel. Something is still remaining. So for that, again, they call it as constipation. So they go 2-3 times a day, but still they call it as constipation. And some people have their stomach bloating, abdominal bloating, stomach pain, cramps, that sort of things, and they say it is constipation. So we have to inquire what exactly is what they mean by constipation, and then we have to address that properly. So in general, let me describe how our digestive system works. See, from mouth to the anal canal, it is actually almost a single tube. From here it becomes something called esophagus or our food pipe. Then it becomes stomach. Then it becomes small intestine. Then it becomes large intestine, which ends in rectum. And from the rectum, it comes out through anal canal. So this is the whole tract. It's a single tract made of 2 layers of muscles covered with an inner lining called mucous membrane, outer lining called serosa. So this is how it is. In each area, it will be differing in the size and its functions. So for example, in the esophagus or food pipe, there is no digestion and all there. So when you eat, it is only a conduit going from the throat to the stomach. No digestion takes place there. So it is there, it goes off simply. So, but the whole movement of the food or water, whatever you take, it is not by gravity. Even if you do something called Shirshasana, where your head is down and your legs are up, and you eat food, still it goes. That is because of a system called peristalsis. So when we eat food, when it is passing through the food passage, so food comes here, the upper portion contracts, it squeezes, the lower portion relaxes, food comes. Then this squeezes, so this is how by squeezing sequentially, it passes from the mouth, from the throat at least, to the anal canal. But the speed of that peristalsis will differ from place to place and depending on the need. Because in food pipe, it goes off. Whereas in the stomach, it has to remain for 3-4 hours for it to get part of digestion there. So acid will come there, and then it will all squeeze and all that, make it into a little pasty thing. Then slowly it will release into the small intestine. In the small intestine, bile juice comes, pancreatic juice comes, and then other juices from the small intestine. They will have all different enzymes. So chemically they break down all the ingredients like proteins into amino acids, carbohydrates into glucose, and fat into fatty acids. They may break it so that all that can get absorbed. And then most of the absorption takes place in the small intestine. So after that, then because a lot of fluids will be added in the small intestine, including bile and all. That's why the color also changes. Bile will be a little greenish or yellowish, Then from there it enters into the large intestine. In the large intestine, lot of fluids are coming from the small intestine. It is in a fluid form. So that much of fluid we can't afford to lose, we get dehydrated. So what large intestine does is it absorbs all the water from that and makes into a little form stools like pasty, this one, or small balls of stools. Then from there it passes and it comes to the rectum, that is the last part of large intestine. When it gets filled, we get the sensation of passing stools. Then the anal canal, which is surrounded by two rings of muscles called sphincters, which will be normally kept closed, that will open, then motion comes out by the squeezing of the rectum. So this is how the passage. So in this, the peristalsis is what we call, is plays a very big role in the constipation or normal bowel movement. So let us understand, when there is a constipation, when the patient is not able to pass motion properly, there are three different reasons. One is there is some obstruction somewhere in the passage. Usually it will be in the, if it is not cancerous, usually it will be in the anal canal, where either because of some fissure or the sphincters are tight, not relaxing properly, then we can correct it by surgery. So loosen the sphincter so that it comes out easily. Or if there is a tumor or stricture, or if it is turned like this, then the obstructing, we will be able to correct it surgically. That is the only part of constipation where we can correct surgically by doing some operation. The other one is peristaltic movements, that as I told you, that movement of the intestines. So that we can't improve it by doing any surgery. So there it is medical management. So we have to understand how the bowel movements are happening. Supposing there is a disease called hypothyroidism, in that the bowel movement becomes slowed down. So all the movements become slow down and they get constipated. Or some medicines, they make the bowel movement slow. Or metabolically, some people have slow bowel movements. So for them, we have medicines to improve the bowel movements. For people who have very fast bowel movements, we have medicines to reduce it. So that is one aspect. Third is the passenger inside, which is the food. So food itself makes the bowel movements improve, or the passage of this one slow or fast. How? See, in olden days, whenever we used to food, we used to mix, especially in South India, we used to mix rice and rasam, sambar, that sort of thing, squeeze nicely, make it more liquid, and we used to eat like this. And lift the plate and drink. So more or less it used to be semi-solid and liquid sort of food when we used to eat. Now what we eat is more or less very dry type of food. We call it as the chitrana, palav, biryani, roti, then bread, pizza, whatever we eat, they are all dry type of food. So the food itself will be dry. And over and above that, if you have not taken enough water, that becomes dry. So that itself can lead to constipation, hard stools. So it is better to have food more or less semi-solid and liquid, or even if you are eating roti, bread and all that, eat with soups and all that sort of things. More with curries, make with more gravy and all. Then the other part of food is, if you are eating too much of spicy food, it will increase the bowel movement. So you will have 2-3 times of motions. So bowel irritation causes more. Some of them will be caused because of some psychological reason. That is called IBS, irritable bowel syndrome. So there are many reasons for that. That also is medically treatable. But if you are constipated, that in irritable bowel syndrome, there is one variety called constipatory type also is there. For that we use different medicine. So it is medically treatable, and by way of diet also we have to make amends depending on the type of issue they have, whether it's constipatory or whether it's loose motion. Then food, if it doesn't contain enough of fiber, the formation of stools only is not happening. So if you're supposing somebody takes only liquid sort of food, only fruit juices, this tender coconut water, buttermilk, but is on only liquids, clear liquids, there is nothing to form stools for them. Or if they eat only non-vegetarian food, only meat, so it all gets digested and completely gets absorbed. So there is no fiber again. So they will also get constipated. So when the people say when I eat more of non-vegetarian, it is more or less because they have not eaten enough of fiber. So whenever you eat non-veg, always have some sort of vegetables, fruits along with that, salads, that sort of things along with that to prevent constipation and reduce the intake of meat and increase the intake of your vegetables, fruits and other sorts of food and make it more or less liquid. So instead of eating a kebab, eat more a cooked meat. And then if you are eating too much of spicy, make it less. So this is how we have to manage the diet, manage bowel movements. Bowel movements can be improved if they are very sluggish by doing more with physical exercises. If somebody is a couch potato sitting always, his bowel movement will be slow. So bowel movement can be improved by physical activity, certain yoga asanas, all that also can improve. So total lifestyle changes will be required and the suggestions will be given according to the type of constipation patient has got and other diseases or other medicines whatever he is taking. All that has to be treated in totality rather than, okay, you take this syrup or you take this powder, it will happen. That is the wrong way of doing and causing more issues and people get addicted to it. Instead of improving their natural improvement in their bowel movements, we are giving them artificial supplements, that sort of things. In India, usually we don't require much of fiber supplements because that is being promoted on a very large scale and even doctors are confused and for everybody they are writing fiber supplements. We don't require that. We eat enough of vegetables, fruits and all. We tell them that how you have to take it and that should improve it rather than depending on outside supplements and bowel movement improvers. Rather, it is better to use more naturally even if it takes a little longer time. Because anything, whatever we are taking additionally, especially medicines, they will all have some impact, some side effect in some other systems. There is no doubt about it. So we must be careful in choosing that. Maybe temporary measures as doctors we can prescribe that. So whenever somebody is constipated, they must know that there are different varieties and different causes of constipation and individually what to search and treat it in totality. That's what you have to understand. There is no across the counter medicine or just search on Google or somewhere else and then take up on your own and destroy the system. Don't damage the system. Once it is damaged, lifelong people will be suffering. So take care of your health by natural means.